Hello, we're going to talk about unassisted prenatal care. So doing prenatal care on your own. Anyone can do their own prenatal care, even those who have a provider as well on the side. You can attend your prenatal care with them and then also in your home do it by yourself on the times that you are not there. Typically in the beginning of pregnancy, providers will only want to see you once a month, and then when you get into the later parts of pregnancy, they will want to see you more frequently. So in those middle areas in between, you are able to monitor your own pregnancy if you would like. I personally find it to be very empowering, and I also find that it is a great way to include the family and have them a part. So it would be done in home or wherever you are, and your whole family can be there. You can wear your PJs, you can wear whatever you'd like. There would be no pressure. There's no you have to fit a certain standard, etc. It's just comfortable and, in my opinion, very intimate. It also can help teach the child. So if there are children in your home, it can help teach them the different ways that we can care for our bodies and show them the different ways to measure and all of those different things. And that can be empowering for them. Not only that, I find that it helps with bonding with the siblings, with their new to come sibling. They can listen to their heartbeat. They can feel them moving. They can measure. They can help mommy. And that kind of stuff is super, super fun. It has been for me anyway. And watching them learn and their eyes just light up with the clients that I serve, that is the best thing, watching their prior children be a part and be able to feel and see and also be able to hear, and just watching them get excited when they hear that heartbeat. So I think that is one of the biggest benefits of that, aside from being able to wear your pajamas and not having to leave your house. That's really cool. You also get to choose what you'd like to monitor. So whereas if you attend with a provider, if you wanted to do it solely by yourself, you can choose what you're going to do. No one is going to say you have to do a GBS swab, you have to do your glucose test, you have to. You don't have to do anything, quite frankly. And you can do all of it yourself. Of course, aside from ultrasound, if you would feel that would be needed, you would obviously have to do that on your own, going to seek assistance, etc. So in choosing your own things that you can monitor, you don't have to feel pressure. So you don't have to feel like, oh, I have to meet a certain weight. You don't even have to measure that. Quite frankly, I don't agree with measuring weight in pregnancy. I think that it can be overwhelming. If there's concern about weight, you would address it or maybe monitor in that scenario, but I don't think that it should be standard. I don't think that everything should be standard for pregnancy. We should not monitor each pregnancy the same because they are not standard. There is no standard. They're all going to be very different, and each of our needs are going to be different. Some will feel the need to monitor more, some will feel the need to monitor less. So this is a sheet that I give to my clients to use if they would like. This is from the Hesperian Book of Midwives, and this covers a few of the different things that we can track in our pregnancy if we so choose. So some of those things are going to be like our hemoglobin, and that's more our iron level. For anemia, that would be a factor for blood loss, possibly. So we want to make sure that those numbers are good, possibly. Blood pressure, fundal height, measuring the size of the womb. We would also do belly mapping. That's one of my favorite to do with myself and my children, is having them feel the baby and trying to figure out where baby is positioned, etc. Listening to fetal tones via Doppler or with the fetal stethoscope. I personally prefer the fetal stethoscope. If you are past 20 weeks, are able to pick up the tone with the fetal stethoscope, because it is the crystal clear sound of your baby in the moment that it's happening, not delayed, and it's also not digitalized or being relayed at a later time, seconds, etc. So if you've never heard a fetal tone with a fetal stethoscope, I highly suggest. Highly. Also, in doing this yourself, if you do this solely on your own and you have no provider, if you find concern and you're like, okay, this isn't measuring right, things aren't feeling right, and things just aren't adding up, you always have the option of seeking prenatal care. So those who are going for unassisted birth and they have an unassisted pregnancy, some of them feel that they cannot seek assistance at all. Like, it's a black and white, we have to do this, or we can't go and seek assistance. And that's a really toxic mentality, in my opinion. I feel that we should really be monitoring our own needs and our baby's needs. If that would include assistance, which some cases absolutely will, we should obtain those and we should seek those, in my opinion. So yeah, that's what I'm saying about prenatal care. That's all I've got to say for you. Yeah.